by Rami Rajab, the chairman of Mecomed. How are you?
I'm very good, thank you.
And how's the show going for you so far?
So far, so very good, unexpected, and very happy to be here after 2 years.
Wonderful news.
Thank you.
So tell us about your role in the Middle East and Africa.
Well, Mecomed, the Middle East and Africa Medical Device and Diagnostics and Imaging Trade Association. Main role in the Middle East and Africa is to shape the industry and keep the patients first and make sure that the industry is in one voice working on the solutions with the governments and with the institutions and all the stakeholders to make sure that our devices that we manufacture and develop and actually solutions find their way to the patients in the fastest, safest and best possible way.
And tell us about the future of digital healthcare in the region.
What COVID did is, COVID was the catalyzer that sped up the process of digitization within the area. This was coming anyway, and it's been few years that many of the companies have created in the C-suite a position which is the Chief Digital Officer. But now with the COVID-19, with the need to speed up the process and make sure that the patients and have a minimal interaction with the hospitals, we are seeing the digital health moving into a higher gear. Today, what we will see in the near future, started seeing now, is that the patients, when they get to the hospitals, they get already tested, they get already prepared before going to the hospital. The hospital will be transformed into a place where procedures will take place versus simple visits and simple discussions. Many of the discussions with the patients and between the patients and the HCPs, healthcare professionals, are taking place digitally through video links, and I think this will save time and will try and also increase capacity, and the patients will be able to use the beds of the hospitals on really urgent needs versus the diagnostic tests that were taken before days in the hospital and which could be replaced by a home-based solution.
And tell us about your cooperation with the regional government.
Well, like with the COVID and before the COVID pandemic, without cooperation, there will be a disruption of bringing in the technology to the healthcare providers in due time. Our work starts with the ministries of health, with the regulators, to make sure that the regulators know what the products are. We even pre-show them the products, discuss with them the particularities of certain solution. And with this, we make sure that the products are approved, they are proven safe to the authorities, and that way we can bring them in safely. On the other hand, what we do with the authorities is to work on topics like data privacy, because again, we need to make sure to give confidence to the government that our products and communication, when we do have remote monitoring or remote health, that data is encrypted and the patient, let's say the patient's privacy and safety is guaranteed by our companies through encryption and anonymization of the data.